My name is Amanda Lyon, and if you're wondering why is there an issue with the overaging population, then you came to the right presentation. So here is Overaging Population and Society's Solutions. Overaging population. Compared to China, Japan, and other parts of Europe, Americans are decreasing their concern and worry of the increased aging population. The increase of aging population brings an increase in pension payouts, medical care costs, and a shrinking workforce. So what does that really all mean? As the population in the United States continues to reach the age of retirement, the cost to support retired citizens increases. So when we retire, what will we be left with? This creates a burden on the social and economic society today. The U.S. population is set to increase 89 million to almost 401 million people by 2050, which is a lot of people, while countries such as Japan, China, Germany, and Spain will see declining populations. Bowerman, 2014. These numbers create an environment that, if not solved, will bring less economic health and social reform. So many citizens reach the retirement age with stress and uncertainty. For most, the reality of overaging is non-existent, and the problems presented simply are not there. So the overaging population, to many, is non-existent. With the influx of population, the need to increase our awareness and reaction to combat these problems today and prevent them tomorrow becomes a solution for society to implement. There are currently about 2 million people in the United States that are aged 90 and over. My grandma might just reach that age. And about 43 million over the age of 65. And my parents are reaching that age even every day, which is expected to skyrocket over 108 million by 2050. Easterbrook, 2014. So when you have 2 million that are over 90 and 43 million over the age of 65, that's 45 million compared to 108 million by 2050. Those numbers are kind of outrageous. This is related to the decrease of smoking and drunk driving and the increase in personal protection, which has driven our mortality rate down. Simply, people are living longer than before. So what are the causes of overaging population? Major advancements to medical care. People are having access to medical instruments and prescription drugs than we've never had before. CRISPR, are clustered regularly interspaced short palindromic repeats. You're asking, what? What CRISPR is basically a genetic gene repeat that is found that can be taken out, altered with a good gene, put back into your body so that Alzheimer's, Parkinson's, and many others would simply just disappear in a person. That's pretty amazing. Also, death is a topic that is avoided by the general population. Realization of our own mortality is frightening and creates a sense of dramatic measures. Simply, people demand health care to prevent death at all costs. Baby boomers are reaching the age of retirement, extending the lives of patients because of higher profits. In the Cost of Dying CBS 60 Minutes segment, an 85-year-old woman received over $40,000 worth of care in her last 2 months of life, including a hysterectomy, a pap smear. Doctors stated tests were absolutely necessary. There's also an increase in immigration. Even though it has a small impact today, it will have a large impact tomorrow. Craig Mello of the University of Massachusetts Medical School believes, in theory, to treat diseases by removing a patient's bone marrow, replacing the damaged gene, and then returning the repaired cells to the patient would eliminate the damaged gene, causing the disease and the patient to be healthy. So if we can do things like that, we can extend our lives and increase the overaging population. Effects on the United States. There's a reduction on our Social Security benefits. Would we even have Social Security? Would they increase the retirement age? Also a reduction in tax revenue. With less people working, there's less money going into our taxes. So that's less money to pay for those potholes in the roads, bridges to be built, and money going into our school systems. There's also an increase in healthcare costs because people simply just want money. And these industries are going to take as much money as they can for those preventative drugs and medical technology. Also, a reduction of government funding for programs. With a higher increase of medical care costs of the overaging population, monies has to go to that program, and it will be removed from other programs. There's also a shrinking workforce. As the overaging population continues, many of them are looking for part-time jobs, which takes away from those that are younger and need those part-time jobs. Also, there's a decrease in spending and an increase in saving. As the overaging population continues to rise, there's less spending because they have to pay for their medical care costs, and they don't bring in as much money as they did before. Helping the aging population. The first step is education. In an NPR's Radio Lab, Johns Hopkins study, 85% of doctors said they would decline antibiotics, blood transfusions, and CPR in the event that knew that they were going to die. While the other side of the story is pretty frightening. The majority of Americans stated that they would take all measures at all costs to prevent death. Also, the Right to Die bill, enacted in Oregon in 1997, and it's followed by New Jersey and California. It's a bill that allows a person who is medically, terminally ill and will not recover to end their suffering legally. Expand living wills, advance directives, and do not resuscitate orders. This is all in part of Maslow's need of being oneself. We need to be in control of ourselves, and if we can't choose the right and have the right to end our suffering, then what can we do? We also need to develop and modify our workforce programs. We need to help the elderly with part-time jobs, and we need to support younger workforce. Develop, recruit, and train care workers and caregivers, because there's going to be a shortage with the overaging population. And with that increase of the need of caregivers and care workers in home hospice, these part-time workers that are younger can move into a full-time position. And we also need to spend money on researching preventative treatment and equipment. And we need to push the age of retirement past the current year of 65. We need to address the influx of immigration. So the United States has a decreased concern of the overaging population social issue as compared to China, parts of Europe, Japan. But people are living longer, and some are living healthier. And living longer must be planned for by the individual and the country. And employers have a duty to teach their individual associates how to treat and plan for that overaging population. Planning today for tomorrow will only lessen the economic and social statuses and issues that could arise with the aging population. I have compacted two helpful sites. One is Planning for Retirement, which is Fidelity.com, and it will help you identify those gaps that you might have when you reach the retirement age. Then also a retirement planning calculator. But it's never too late to start learning how to retire appropriately. These are the resources and references that I used throughout this presentation. So I hope that you learn that we do have an issue with the overaging population and that you yourself will do something about it.